My name is Mary Simmons. I'm a Richmond native all my life. I worked for Virginia Commonwealth University for 29 years. I was diagnosed April 2022 with acute lymphoma leukemia. That experience was heart-wrenching for me because I was told that I had less than 2 weeks to live. It was an iconic moment when the doctor was like, "Take care of my affairs." I refused to believe it. I wanted a second opinion. They mediced me to VCU Medical Center, where I saw a team of people. They had the same prognosis, but they also informed me about clinical trial. And that's how I met my doctor, Keri Maher.
Mary is my superstar patient. I met her first day here at Massey. She came here, of course, scared, upset, all the feelings, but also motivated. We talked from day one that it would be quite the journey. Acute leukemia, you go through at minimum 8 cycles of really intensive chemotherapy for her type. So we talked about what all that would mean. And she said, "Let's do it, let's get it done."
I said yes, because at that point, I was at ground zero with everything. So this was my life turning point for me, getting on the clinical trial.
Clinical trials for cancer patients, but all patients, but cancer patients in particular, is just indispensable. We have so many cancers that still have bad outcomes, and acute leukemia are some of those cancers. Average overall survival, just for an example, for an adult age 65 or older with AML, average survival with treatment is 14 months. And the only reason it's that good is because clinical trials have brought us to that.
The team rallies around you. They're your family outside of your home life. They were all compassionate, making sure you have everything that you need, making sure that they understand your process.
My patients aren't patients, they're people. Mary and I share a birthday. We kind of got to joke about that and celebrate birthdays together and things like that. One thing about Mary though, day one, she was always her own advocate. She was never afraid to tell people, "You gotta watch my sugars better because you just put me on steroids." So Mary was always like that. And honestly, that's part of the reason she did so well.
My life has changed. It felt like I have been rebirthed. I have my body back. It feels really great that I feel normal. I would like to share my experience with others, let them know that they need to continue to fight, letting people know about clinical trial, that it works, it's a lifesaver. Understand it and have discussions with your doctors about the treatment plans. Then also make sure that you communicate it with your family, because it's a journey. You need your support system, your family, your friends, and even your hospital staff.
Now that she's done and in what we call long-term follow-up, so we're just monitoring her, making sure it never comes back, now I feel like we truly get to be friends. She gets to tell me about all the wonderful things she's doing. I love all the advocacy work she's doing. Being a cancer champion, a community advocate, she goes and argues for us on Capitol Hill. She's just an amazing human in all senses of the word. But I feel, she says that she's lucky to have met me. I say the other way around.